In this vlog, I want to present some characteristics of the skill or capacity issues that athletes might have when performing exercises in the weight room. I will discuss the main technical problems during the back squat and the Romanian deadlift, highlighting if due to a skill or a capacity issue. After that, I will provide them with corrective exercises and alternatives after an assessment that ensure I target the correct issue. The first athlete is a 24 years old, a good 400-meter runner, had a history of right-sided acetabular impingement of the femur and low back pain years ago, and is experiencing strength training difficulties with certain movements. As we can see in this clip, this athlete has one major issue that is invincible, especially during the concentric phase. In the lateral view, his main issue is more appreciable. He moves his hips before the trunk when returning from the very lowest part of the squat. He doesn't show an optimal parallel alignment between the trunk and the shins, even during the descent phase, but during the ascent phase, he increases this discrepancy, losing completely the parallel recommended alignment, as Meyer et al. 2014 recommended. The good movement pattern during the descent phase of his back squat made me suspect a skill issue, so I tried to implement his pattern of movement, giving him the cue, push like you got a resistance over your head, and he did implement the execution but wasn't consistent, alterning some good and bad back squat execution. I tried to improve his technique by adding a stick to help him appreciate how his back and hips should move all together. Short after a few sets, I implemented his back squat directly with the same cue as before, push like you got resistance over your head, adding also a minimal resistance over his head with a stick. All these taken together seemed to work well because he showed immediate improvements. Athlete 2 is a 30 years old amateur runner. She got right knee surgery 10 years ago and she told me didn't fully recover her functionality. She reported diffuse pain right after strength training sessions. Watching her perform a back squat shows that difficulties are preventing her from performing the exercise correctly. I asked her to remove her shoes to better appreciate what was going on at the feet level. From the lateral view, it is possible to appreciate two major problems: the heel rise during the deep phase and the non-reach of the parallel. From the front view, the heel rise is always appreciable, with the addition of dynamic knee valgus. The valgus was easily modifiable by simply pointing out this characteristic to the athlete, which made me focus my attention on the other major problems highlighted. Assuming a limitation of mobility and therefore a capacity issue, I evaluated the dorsiflexion with a knee-to-wall test, and the athlete proved to be at the limit between hypomobility and normal range, according to Adilon et al. 2022. Even with the heels raised considerably, the parallel was barely reached. Then I evaluated hip mobility, which is a common limiting factor of back squat depth. Also in this case, mobility is limited. Given the athlete's history, I also evaluated the mobility of the knees, which resulted limited but was not relevant to the execution of the back squat. Having highlighted the limitation of mobility in the hips and ankles, I administered an exercise to increase hip flexion and an exercise to increase ankle dorsiflexion. In the meantime, I suggested training with an elevated foot split squat as it allows to quickly overcome her mobility limitations. As announced in the second part, I will analyze the Romanian deadlift of the same two athletes. Watching athlete 1 perform the gesture, I noticed two major deficits. From this clip, we note an excess of knee flexion, which should be limited to 15 degrees, and an excessive motion of the barbell away from the lower limb, which should remain close to them, as reported by Piper et al. 2001. Taking advantage of his execution of the back squat as a screening, I hypothesized a further skill issue. Simply introducing the cue "rub your legs" with the barbell, the athletes managed to improve the technique, demonstrating how this problem was a skill deficit. As shown in this frame, he continues to flex his knees to match. Then I asked him to perform the same gesture with his toes in contact with the box as shown in the video, but with the addition of the cue "create the space to drop the barbell." In this modality, his technique is notably improved and suggests once again the fact that athlete 1 possessed a deficit in terms of skill rather than capacities. Regarding athlete 2, who already previously demonstrated capacity deficits, especially in terms of hip flexion, I was expecting she could have difficulty in adequately performing the Romanian deadlift. As you can see in the video, in the initial part of the gesture, the execution is good, but then something happens. From the side view, it is evident that although initially there is a good control of the arched position of the back with an optimal alignment, at a certain point of the descent phase, the athlete loses control of her posture, ending up in a kyphotic posture. By asking the subject to perform the gesture with a stick and giving the cue "show your badge" to someone in front of you, she can preserve the arch, but the motion range becomes much more limited. As reported by Piper et al. 2001, the movement should end when the athlete needs to round the back, but her mobility is quite restricted, possibly limiting the desired adaptation normally induced by this exercise. From the previous evaluation of the back squat, I assumed that the hip flexion limitation was not such as to be able to limit this movement by this entity, and therefore I used the sit-and-reach test as screening to evaluate the extendability of the posterior chain. As you can see on the video, the limitation of the mobility is significant and such as to constitute a capacity issue. I suggested her a loaded trunk flexion in sitting with slight knee extension to stimulate adaptation in the extendability of the posterior chain and possibly also an increase in range of motion for the hip flexion. In the meanwhile, she could train herself with a restricted Romanian deadlift or with the conventional deadlift, given that the reduced hip flexion could limit the adaptations at the spinal erector and gluteal level. In summary, I want to point out that athlete 1 showed skill issues in both exercises, while athlete 2 demonstrated capacity issues in both exercises. As shown in this vlog, there is a need for a proper assessment to correctly determine the type of issue, because to solve them there are two completely different solutions. Skill issue can be solved quickly with the introduction of cues or environmental constraints, while capacity issue need corrective exercises to be addressed and a relative amount of time to get the desired adaptation. Solving this issue enables the athlete to maximize exercise-induced adaptation and minimize the risk of injury.